Hello, this is Dr. John Y.K. Lee, and I'm back basically to discuss spine versus brain. What do neurosurgeons actually do? 10,000 surgeries were cranial, 28,000 were spinal. So that really is 73% of the surgeries being done by neurosurgeons are spine surgeries. The brain versus the spine. Which one do we neurosurgeons actually operate on? What do we train on? What do we get better at? What do we actually do when we go out into practice? And so this came up because of my response video to Dr. Gooby and his dog Doobie. And I realized that a lot of people, and including myself when I first started, didn't realize what neurosurgery involves. Most of us think of neurosurgery, we think of brain surgery. However, a lot of what we do actually in practice, especially if you go to private practice, is not brain surgery, it's spine surgery. Now, one of the reasons I decided to do this video was because I recognized there's a misconception of what neurosurgeons do, but actually when I did my little bit of Google research and looked on YouTube, most of the videos targeted why you should see a neurosurgeon or an orthopedic surgeon for your spine surgery. And no one really talked about, well, what do neurosurgeons do in the percentage of cranial versus spine? And I did a little bit of research, and I want to pull this up for you and help you to understand what it is that we actually do as neurosurgeons. So in this first paper, John Rolston, a functional neurosurgeon now at the Brigham, he looked at when he must have been a resident at UCSF and published with Mitch Berger and the late Andy Parsa, and they looked at the NSQIP database, the NSQIP database. This is run by the American College of Surgeons, and it's a really great attempt to get at surgical outcomes as well as trends and patterns. What number of cases do neurosurgeons do that are spine versus cranial? So in this example, 10,000 surgeries were cranial, 28,000 were spinal. So that really is 73% of the surgeries being done by neurosurgeons are spine surgeries. So that does give me perspective, and you perspective. 73% back in 2006 to 2011, 73% of the surgeries being done by neurosurgeons were spine surgeries. Now let's go forward. The next study, this was a follow-up to that study, so this is also a NSQIP paper, and they looked from 2006 to 2013, so just 2 years additional, but what they noticed was a trend. Every year there seems to be a drop. The number of cranial procedures, percentage-wise, the percentage of cranial surgeries that neurosurgeons are doing is dropping, but the number of spinal procedures is increasing. So what's happening is the number of cranial procedures, percentage-wise, is dropping. Spine is increasing. So now spine is 78 to 79% of what neurosurgeons do. Now, in this next slide, Nitin Agarwal, who was at the University of Pittsburgh, and Kojo, they looked at the training of neurosurgeons. So if you're going out into practice, and most 80% of what you're doing is spine surgery, but what do you learn on? And this was interesting. Graduating neurosurgeons in this period from 2013 to 2017 graduated having performed over 400 spine surgeries. And every year they noticed that the number of spine surgeries that they're doing was increasing by 20 surgeries on average every year. They looked at the same database, and this is training logs. So whenever I was a resident, we had to, every time you do a surgery, you had to log in what you did, and that was a way for them to keep track of what's being done and what the training is like at that procedure, at that institution. And that all gets uploaded to a master database. So when they queried that master database, they were able to determine what's going on over time. And this longitudinal study shows that the number of cranial surgeries, actually you graduate with 577, and every year actually the number of craniotomies is also increasing. And so what I take from this is that in training, you might do more craniotomies, cranial surgery, than spine surgery. But then when you go out into practice, almost everything that you do is spine if you're in private practice. So the only group that's actually doing a lot of cranial surgery are the ones who are in the main hospitals, the teaching hospitals. So I think it's also a lesson to you if you're a patient. If you have a brain problem, you need to go where the brain surgeries are being done, which is the university centers, or somebody who's affiliated, or somebody who has exposure to universities. Now, neurosurgeons, when they graduate, they've done over 400 spine surgeries, as we talked about in that other paper by Nithin. In this article, this is an orthopedic article published in the JBJS, and Larry Lenke is the final author. And there they recognize that orthopedic residents are graduating with only 100-something spine surgeries being done. So they have to go do a fellowship. So their exposure to spine surgery is much less. And that's probably because neurosurgeons are just doing lots and lots of spine surgery. Now, this is just Becker's Spine Review, which is kind of this free spine trends newsletter that you can get. But it is interesting because they talk about how neurosurgeons seem to be taking over spine surgery, and it's becoming more and more common that orthopedics is doing less and less spine relative to neurosurgeons doing spine. We have about 4,900 or almost 5,000 neurosurgeons. There's more orthopedic surgeons, but very few of them are doing spine surgery. Even though I'm a brain surgeon, I actually do very little spine. My colleagues in private practice out in the community are doing a lot of spine surgery. So I hope this is just informational. All I really wanted to point out here today is that I'm a neurosurgeon, and in the field of neurosurgery, all 4,900 of us, there are some of us who focus completely on cranial surgery. There are those who do a mixture, but there are a lot of my colleagues out in private practice who almost exclusively do spine surgery. My advice to you is ask your surgeon what do they mostly do on a daily basis, and pick and choose based on what they do. If they do a lot of spine surgery, then they're going to be good at spine surgery. If they do a lot of cranial surgery, they're going to be very good at cranial surgery.